So one of the things you have been talking a lot about recently is the NHS privatisation. So we've currently got the Health and Social Care Bill making its way through Parliament, and we can get to that in a minute. But I thought we'd maybe just start with where NHS privatisation sort of begins for you. Like, where does that story start, and where has that led us to now in the situation we're at before this bill gets potentially passed?
Well, the NHS has never been completely national, because GPs have always been not actually employees of the NHS. They traditionally used to be either sole practitioners or in partnerships. So it's never been 100% NHS as NHS employees. But what we've seen is that over time, and particularly over the last 40 years, there's been quite a determined move to get health and social care so that instead of being a universal service which is paid for by progressive taxation and available to everybody free at the point of use, increasingly people are having to pay for things themselves. So when we talk about privatisation, the government always denies that it has done any privatisation or has any intention of doing any privatisation in the future. But if you think about privatisation, actually there's not just one way of doing it. I think it's true that they are not going to turn the NHS into a PLC and then sell it in a trade sale or float it on the stock market. That's true. They're not going to privatise it in that way. But there are three other ways that they can make people pay privately for their healthcare. So one way is something they've been doing a great deal of, which is contracting out. So large numbers of things which used to be done by NHS employees are now done by private companies. So if you call 111, you'll be speaking to a private company. If you ride in an ambulance, you'll almost certainly be riding in an ambulance which is owned and driven by people who are employed by a private company.
Wait, what? Really? Like most of the ambulances?
Yes, I think so.
Wow. Okay.
Yeah, wow. And many other services. So in itself, that's not necessarily a disaster, because you're not charged if you call 111. You're not charged if you go in an ambulance, whereas in the States you would be charged, maybe $3,000 for an ambulance. So it's not as bad as that. But the problem is, the argument for contracting out is supposedly that it's much more efficient. But what we've seen in particular during the pandemic is that it can be vastly more inefficient. So the government ministers got personally involved in the procurement of personal protective equipment for staff. And they have wasted, according to the Department of Health's own figures, the best part of £10 billion of our money. And the reason they wasted it was because they didn't procure from companies that had a proven track record. They set up a VIP lane where contacts of ministers and party donors and people could put in bids. So some big bids were won by companies which had nothing whatsoever to do with personal protective equipment. One of them was a private office for a very wealthy family. But essentially, it's like a kind of personal bank that exists to make that company richer. And because they had contacts with ministers, they were then able to act as the intermediary for a huge contract, which was about 250 million pounds. And they got somebody to provide equipment, most of which was unusable. It wasn't actually usable. So huge amounts of money going to favoured people in the corporate sector who are well connected with ministers or big party donors, crowding out the suppliers who could actually have done it. So not only is it a huge loss of money, of our money being given probably illegally. I mean, these cases are still going through the courts, but our money being given to these donors and contacts of ministers, but also at a time when that equipment was desperately needed. It wasn't getting through because the warehouses were filling up with unusable stuff. So lots of needless deaths caused by it as well. And of course, if you think 10 billion is a lot of money, then 37 billion, which is the amount in total that was earmarked for the test and trace system, is of course an even larger amount of money. It's actually a mind-blowing amount of money to have spent on a test and trace system. Mm-hmm. When I was looking at it, I was trying to think, well, how much money is 37 billion? It's completely outside my experience, and I dare say your experience as well, to have anything remotely like that amount of money. So I tried to think, well, what would you expect to buy with that? And I discovered that if you add up the annual budgets of the three armed forces, the Army, Navy, and the Air Force, that's 39 billion. So the amount that they have earmarked for test and trace was effectively the same as 1 year's budget for all three armed forces. And when you walk around the country, you see the evidence of that. You see people in uniform, you see jets flying overhead, or helicopters or cargo planes. You see people in khaki lorries. You occasionally see tanks being moved around. You see the evidence everywhere. If you're by the coast, obviously you see frigates and destroyers and occasional aircraft carriers. So you can see where billions goes. But you can't see where billions have gone, and certainly not tens of billions in the case of test and trace. And when the National Audit Office looked at it, they concluded it was failing. So not only did they spend vastly more than you would expect, again through these VIP lanes, but they ended up with a very, very expensive service that didn't really work. And again, that results in loss of life. So it's not just that they're plundering the public purse, it's also that they're completely careless of the loss of life that this causes. So that's contracting out. That's the reason why contracting out isn't good. Then they can throw you out. So a few years ago, your GP could prescribe over-the-counter medicines to you. And so if you were poor in particular, that was very valuable because you got a prescription and you took it to the pharmacy and you got your over-the-counter medicines. Now you have to buy them, and they're typically not the most expensive medicines, but nevertheless they're not cheap, especially if you're having to take them regularly. So people have been thrown out, and over time we've all been thrown out. When I was a child, for example, glasses, and probably contact lenses weren't such a thing, but glasses were on the NHS. Now they're not. The dentistry is not really available on the NHS now. It is in principle, but it's quite hard to get it now. So you can be thrown out. And the last way is that you can be squeezed out. So simply by making sure that the NHS is underfunded, which they've been doing for 10 years, waiting lists have built up. So we've now got record waiting lists of about 6 million people. And that means that people who have perhaps not life-threatening conditions, but painful conditions get squeezed out and they go private. So last year, for the first time ever, more people had hip replacements done privately than on the NHS. Now, a hip replacement can cost anything from £8,000 to £15,000. So if you're wealthy, it's a huge expense, but you can afford it. So you've been squeezed out. If you're poor, you're just still waiting. You're still in great pain every day, waiting for 2 years for your hip replacement. So it's true, in other words, that the government probably isn't going to do that great big sell-off, but they have been contracting out, they have been throwing us out, and they have been squeezing us out. And those are all ways of expanding the scope of the private sector in UK healthcare. And if you want to know why they're doing it, well, if you look at the American system, it is the worst system in the developed world in terms of
actually, Mark, can we pause there, because I just want to like clarify a few things you've said there just for people, and then we can go on to the why. So, sorry to stop you in your tracks, but I just thought that was the best place to get a pause there. So I just wanted to pull up a couple of articles for people here that I have been looking at that were just to sort of confirm and add to a few things you've said here. So I'm not sure you'll be able to see them, but I'm going to read out what the important part is. So this is from The Guardian. There was an investigation 5 years ago after £63 million contract was handed regarding ambulances, and there was patients left waiting. But then the stunning part is from LBC. So this is from 2019 now. That we now spend £92 million on private ambulances per year. Now that's 2 years ago, so we don't really know what the number is now. And then that number was just absolutely stunningly in 2011 just £400,000. Which and that's from Full Fact. So I mean, it's amazing how much we spend on that. I can't get over it. And to your point about the NHS test and trace scheme, I'm not sure if this is accurate, but I did see this trope going around that it was one of them. I think it was the fourth most expensive singular project in human history, behind the U.S. Interstate Highway, the International Space Station, and the King Abdullah Economic City, which I'm not sure where that is. But to build a whole city, 69 billion, and then next comes the test and trace system. Wonderful. It's stunning, and we will get to the looting of the British taxpayers' money in a minute. But thanks for making it all the way to the end of the video. Don't forget to like, share, subscribe, and leave a comment for us in the comments below. Let me know what you thought and if you'd like to see more of this from the show. Thank you, and we'll see you again next time.